Malabsorption syndromes. In this, there will be chronic diarrhea and there will be steatorrhea, that is fatty stools. Fatty stools is the most common characteristic finding of these malabsorption syndromes. Under the malabsorption syndromes, we have three conditions or three diseases. One is celiac disease, second one is tropical sprue, and the third one is Whipple's disease. Celiac disease. This is also called as gluten sensitive enteropathy. The genetic association is with HLA DQ2 and 8. In this, because as they are gluten sensitive, there will be decreased TTG, that is tissue trans glutaminase, and thereby gliadin. And the CD8 T cells will cause epithelial cell damage, and CD4 T cells will cause abnormal antibodies of IgA type. That's why you can appreciate in the skin dermatitis herpetiformis. So, celiac disease is diarrhea with duodenal villus atrophy and crypt hyperplasia. The cereals that are containing the gluten are barley, rye, oats, and wheats. So, these are having the gluten. So, these foods are to be avoided. These cereals are to be avoided. And this celiac disease is seen in pediatric age group of 6 months and in also in adults of 30 to 60 years. The chief complaint will be diarrhea or steatorrhea, abdominal pain, flatulence. In few cases, there will be nutritional deficiency leading to anemia or stunting growth, failure to thrive in the pediatric group. And it is associated with type 1 diabetes mellitus, Sjogren syndrome, thyroiditis, and IgA nephropathy, Down syndrome, and Turner syndrome. Diagnosis symptomatic upon starting the cereals. Serology for the antibodies. The antibodies, anti-transglutaminase antibody is the most sensitive one, and anti-gliadin antibody is the most specific antibody. Along with this, anti-endomysial antibody will also help in diagnosing the celiac sprue. We have to do biopsy for confirmatory test, and when you see under the microscope, as shown in the picture, this is normal crypts and normal villi. There will be crypts hyperplasia and there will be villus atrophy in the duodenum in celiac sprue. So there will be associated malignancies with celiac sprue or gluten sensitive hypersensitivity. They are increased T cell lymphomas, small intestine adenocarcinomas, esophageal carcinoma of squamous cell carcinoma type. What is the treatment for this celiac disease? As they are gluten sensitive, gluten free diet. That is, they have to be given maize, rice, quinoa seeds, or quinoa. And for skin manifestation, that is dermatitis herpetiformis because of IgA antibodies, we have to give the dapsone. So this is about celiac disease. Coming to tropical sprue, this is also called as environmental enteropathy and it contributes around 40% of the cases of malabsorption syndromes and it is due to E. coli infection. And here there is no autoimmune disorder and the involvement of small intestine is total because of the deficiency of iron or folic acid or vitamin B12 absorption. It is a benign condition and it will respond good to the cotrimoxazole, which is an antibiotic. So there is a good response to the antibiotics in tropical sprue. When we do the histopathology of a tropical sprue case, you will see villus blunting and there will be complete lymphocytic infiltration in tropical sprue. In celiac disease, we have duodenal villus atrophy and there will be crypt hyperplasia. Okay, this is the difference. Coming to the Whipple's disease. This Whipple's disease is caused by a gram-positive Trophorima whipple. There will be accumulation of this Trophorima whipple in the macrophages in lamina propria. This is a characteristic. Steatorrhea will be there, and steatorrhea with PAS positive macrophages in the lamina propria is characteristic of Whipple's disease. There will be overcrowding of the macrophages, causing compression of the lacteals and impaired lymphatic drainage, and thereby causing the diarrhea. The hallmark finding will be defective luminal transport. The clinical features will be, as it is multi-system involvement, there will be involvement of the intestines, joints, lymph nodes, and cardiac. There will be diarrhea and steatorrhea. Because of this, there will be weight loss. There will be loss of memory in the advanced stages. On histopathology, as I said earlier, there will be macrophages infiltrated in the lamina propria, and you can appreciate the foamy macrophages. On electron microscopy, you can appreciate rod-shaped bacilli, and they are PAS positive, that is per iodic acid skiff positive, and they are diastase resistant. Remember, PAS positive and diastase resistant. Treatment is same like your tropical sprue, that is cotrimoxazole, trimethoprim plus sulfamethoxazole. So, multi-system involvement, CNS, CVS, and joints are involved. Gram-positive Trophorima whipple or Whipple's disease, and macrophages in the lamina propria. PAS positive, diastase resistant. Like, share, subscribe Dr. Ravichandra official for more interesting videos on pathology.